Hello guys, welcome to my channel MBBS Knowledge. Today we will learn a very important topic from practical physiology, the code of hematology, RBC indices. So let's start it. RBC indices is one of the most boring topic of hematology. Many students get difficult in understanding the actual meaning of these indices. They just start to mug up and after a few days they again forget it. So today I will help in learning this topic and understand the concept behind that for the rest of the futures. So let's start it. RBC indices. For this I'll use some tricks, pictures for the sake of easiness. So let's consider this river. There is a river and in the river there are some balloons which are floating, and inside balloon there is small balls. So we'll consider the river as a whole blood, and this balloon will be the RBC and small ball will be our hemoglobin. So let's start. RBC count. That means number of RBC per unit volume of blood. We can compare with our balloons. Total number of balloons in the whole river, that will be our RBC count. So for male there is a 4.5 million per cubic per microliter, and for female 4 to 5 million per microliter. Now hemoglobin concentration. As you know, concentration is equal to amount by volume. So hemoglobin concentration means amount of hemoglobin per unit volume of whole blood. That means this is the blood, and hemoglobin concentration whole blood will be our hemoglobin concentration. For male 4 to 17 and female 12 to 15. Now PCB, package cell volume. That means package of cells, and what will be the cells? RBC. So package of RBC. So this is the centrifugation of blood, and this portion is our PCB. That means package RBC, and this volume of whole blood will be our PCB. For normal male 45 and female 40%. This simply signifies the percentage of RBC in the whole blood. That's it. Now MCV, mean corpuscular volume. That means the corpuscle means RBC, and the average volume of RBC will be our mean corpuscular volume of RBC, and we can compare it with our balloons. There is a variable size of balloons and also the variable amount of hemoglobin. So the mean volume of balloon will be mean corpuscular volume. Normal value 80 to 100 femtoliter. If this less than 80, we will call it microcytic. Micro means small and cytic means cell, small cell, microcytic. And if more than 100, macrocytic. Macro means large and cytic means cell, so large cell, large volume is macrocytic. And normal value. Now MCH, mean corpuscular hemoglobin. That means mean volume of hemoglobin present in corpuscle, that is RBC. We can compare it our small balls as a hemoglobin and RBC as a balloon. So mean amount of ball in balloon. So let's see here. There is a variable size of balloons and also variable amount of hemoglobin. For the MCH, it means the mean amount of hemoglobin, that is small balls in corpuscle. So there is, suppose there is a 20 picogram, there is a 40 picogram, there is a 25 picogram, and there is a 50 picogram. If the normal value, mean value of that hemoglobin comes to 30 picogram, then it's normal, and if less than 30, it will be hypochromic, and there is no hyperchromic. Either there is a hypochromic or normochromic. So it simply means the average amount of hemoglobin per corpus cells. Now MCHC, mean corpuscular hemoglobin concentrations. See, there is a two concentrations, mean corpuscular hemoglobin concentrations and just hemoglobin concentrations. So what is the difference? Yes, the difference is that just hemoglobin concentration means, as we know, concentration equal to mass by volume. So the amount of hemoglobin in whole blood will be the hemoglobin concentration in general. And what is MCHC, mean corpuscular hemoglobin concentration? It means the amount of hemoglobin in only PCB. that is PCB, and total whole is the whole blood, and this part is the PCB. So hemoglobin density as by volume in the PCB region is called MCHC, and hemoglobin density in the whole blood will be just hemoglobin concentration. So MCHC means hemoglobin amount per PCB, package cell volume. Since it's concentration, that means amount by volume, we can compare it to our density. So mass by volume in PCB. Normal value is 33 gram per dl, and our just hemoglobin concentration 14 to 17 or 12 to 15 gram per dl. We can see that MCHC is more than hemoglobin concentration. As it's obvious, because the volume of blood in the MCHC is less, that is 45% of whole blood, and in there hemoglobin concentration the volume is whole blood. So since there is a less volume, the more amount, 33 gram per dl. Now color index, what does it means? Color index is the ratio of percentage of hemoglobin versus percentage of RBC. For this we will consider the 14.8 gram as a 100% of hemoglobin, and 5 million RBC per microliter will be considered 100%. So the percentage of hemoglobin divided by percentage of RBC will be color index. The normal value is 0.8 to 1.2. Within this region the condition will be normal, or if there is less than 0.8, there will be less hemoglobin compared to RBC, and if more than 1.2, there will be more hemoglobin as per RBC. So that's it for today. Hope you will learn a very important topic by simple way. It will help you in your entire journey, because it's a very important topic for clinical medicine. If you really like it, then like the video, and for future such videos subscribe my channel. Thank you.